Question 1. A 68-year-old male complains of sudden onset of shortness of breath and chest pain that radiates to his left arm. He is alert and oriented, cool and diaphoretic, and his vital signs are BP 100/60 mmHg, HR 110 bpm, RR 24 breath/min, SpO2 92% on room air. What is the most appropriate initial oxygen delivery device for this patient? A. Nasal cannula at 2 to 4 lpm. B. Non-rebreather mask at 15 lpm. C. Simple face mask at 8 lpm. D. Bag valve mask with supplemental oxygen. Answer: B. Non-rebreather mask at 15 lpm. This question tests your understanding of oxygen therapy for patients with acute respiratory distress and suspected cardiac ischemia. The keyword most appropriate initial and the patient's symptoms: shortness of breath, chest pain, SpO2 92%, diaphoretic, indicate a critical patient requiring high-flow oxygen. A non-rebreather mask at 15 lpm delivers the highest concentration of oxygen to a spontaneously breathing patient, which is crucial for improving oxygenation and reducing myocardial workload in suspected cardiac events. For example, if a patient is struggling to breathe, providing high-flow oxygen helps ensure their body gets the oxygen it desperately needs. Always opt for high-flow oxygen via a non-rebreather for patients experiencing significant respiratory distress or signs of shock unless a contraindication exists. Question 2. During the primary assessment of an unresponsive adult patient, you find that the patient has a weak carotid pulse but is not breathing. After opening the airway, what is your immediate next intervention? A. Check for a medical alert tag. B. Begin chest compressions. C. Deliver 2 rescue breaths. D. Apply an AED. Answer: C. Deliver 2 rescue breaths. This question assesses your knowledge of the immediate steps in managing an unresponsive, non-breathing patient with a pulse, a critical component of basic life support. The key finding is the patient has a pulse but is not breathing, which points to a respiratory arrest rather than cardiac arrest. After opening the airway, the immediate next step is to provide rescue breaths to oxygenate the patient. For instance, if you find someone has collapsed and isn't breathing but still has a pulse, providing breaths helps keep their brain and organs alive until more definitive care arrives. Remember, breathing comes first when a pulse is present, as respiratory arrest often precedes cardiac arrest. Question 3. What is the primary purpose of applying direct pressure with a sterile dressing to an external bleeding wound? A. To prevent infection. B. To assess the depth of the wound. C. To control hemorrhage. D. To relieve pain. Answer: C. To control hemorrhage. This question focuses on the fundamental principle of immediate hemorrhage control in trauma management. The keyword primary purpose directs you to the most critical reason for this action. Direct pressure with a sterile dressing is the initial and most effective method to stop or slow external bleeding by promoting clot formation and physically compressing damaged vessels. For example, if someone cuts themselves deeply and is bleeding, pressing down firmly on the wound is the first and best way to stop the blood loss. Your main priority with bleeding is to stop the flow of blood to prevent life-threatening shock. Question 4. You arrive on scene to find an elderly male patient who fell and is complaining of hip pain. He is conscious and alert. What is the most appropriate method for assessing his airway? A. Look, listen, and feel for air movement. B. Insert an oropharyngeal airway, OPA, immediately. C. Assess for vocalizations or ability to speak. D. Perform a jaw thrust maneuver. Answer: C. Assess for vocalizations or ability to speak. This question tests your understanding of airway assessment in a conscious and alert patient. The most significant clue is that the patient is conscious and alert, which strongly suggests an open and patent airway. If a patient can speak clearly and coherently, it indicates that air is moving adequately through their airway. For instance, simply asking, "Are you okay?" and listening to their response is the quickest and most effective way to confirm an open airway in an alert patient. An alert patient who can speak does not require immediate invasive airway adjuncts or maneuvers. Question 5. You are dispatched to a motor vehicle collision involving a single car that struck a tree. Upon arrival, you observe power lines down across the vehicle. What is your immediate priority? A. Initiate patient contact and primary assessment. B. Establish incident command. C. Ensure scene safety and alert power company. D. Apply a cervical collar to the patient. Answer: C. Ensure scene safety and alert power company. This question emphasizes the paramount importance of scene safety in EMS operations. The keyword immediate priority and the presence of power lines down across the vehicle are critical clues indicating a severe hazard. Before approaching any patient or vehicle, the scene must be made safe to protect yourself, your team, and bystanders from potential harm. For example, if you rush towards a car with downed power lines, you could become the next patient. Always prioritize scene safety before patient care. You can't help anyone if you become a casualty yourself. Question 6. A 45-year-old female complains of severe difficulty breathing. She states she has a history of asthma and forgot her inhaler. On assessment, you hear bilateral wheezing. Her SpO2 is 90% on room air. After administering oxygen, what medication, if available and medically appropriate, would be indicated for this patient? A. Nitroglycerin. B. Aspirin. C. Albuterol by nebulizer. D. Oral glucose. Answer: C. Albuterol by nebulizer. This question assesses your knowledge of prehospital management for an acute asthma exacerbation. The key findings are difficulty breathing, history of asthma, and bilateral wheezing, all classic signs of an asthma attack. Albuterol is a bronchodilator medication specifically designed to relax the smooth muscles of the airways, thereby opening them up and relieving wheezing and shortness of breath in asthmatic patients. For instance, giving albuterol to an asthmatic patient helps them breathe easier, much like opening a clogged pipe. Remember, albuterol is the go-to medication for acute bronchospasm in asthma and COPD. Question 7. What is the most critical contraindication for administering oral glucose to a patient with altered mental status? A. History of diabetes. B. Awake and able to obey commands. C. Inability to swallow or protect their airway. D. Blood glucose level above 70 mg per deciliter. Answer: C. Inability to swallow or protect their airway. This question tests your understanding of the contraindications for oral medication administration, specifically oral glucose. The most critical contraindication is the patient's ability to safely ingest the medication. If a patient with altered mental status cannot swallow or protect their airway, administering oral glucose could lead to aspiration, where the substance enters the lungs, causing severe respiratory complications. For example, giving a thick gel to someone who can't swallow properly could cause them to choke or aspirate it into their lungs, which is far worse than their low blood sugar. Always ensure a patient can safely swallow before giving anything by mouth. Question 8. When assessing a 4-year-old child who is sick, which of the following is considered the most reliable indicator of adequate perfusion and oxygenation? A. Blood pressure. B. Peripheral pulses. C. Capillary refill time. D. Skin temperature. Answer: C. Capillary refill time. This question highlights a crucial aspect of pediatric assessment, specifically identifying reliable indicators of perfusion. In young children, capillary refill time is a more reliable and sensitive indicator of perfusion than blood pressure, which can remain stable even in significant shock until very late stages. A prolonged capillary refill, greater than 2 seconds, suggests inadequate blood flow to the tissues. For example, gently pressing on a child's nail bed and watching how quickly the color returns can quickly tell you if their circulation is doing well. Always prioritize assessing capillary refill in pediatric patients as an early warning sign of circulatory compromise. Question 9. A paramedic is intubating a patient and successfully places an endotracheal tube. What is the most reliable method to confirm proper tube placement in the trachea? A. Bilateral chest rise and fall. B. Auscultation of epigastric sounds. C. End-tidal carbon dioxide, EtCO2, waveform capnography. D. Condensation in the endotracheal tube. Answer: C. End-tidal carbon dioxide, EtCO2, waveform capnography. This question focuses on the gold standard for confirming endotracheal tube placement in advanced airway management. While other indicators like bilateral chest rise, auscultation, and condensation can offer clues, end-tidal carbon dioxide, EtCO2, waveform capnography provides continuous, real-time physiological confirmation that the tube is in the trachea and not the esophagus, making it the most reliable method. For example, if you see a consistent waveform on the capnography monitor, it's like a clear signal confirming the breathing tube is exactly where it needs to be. Always rely on waveform capnography for definitive confirmation of endotracheal tube placement. Question 10. A 55-year-old male is found unresponsive. His family states he is a diabetic and recently recovered from the flu. His skin is warm and dry, and he has rapid, deep respirations, Kussmaul breathing. What condition should you suspect? A. Hypoglycemia. B. Diabetic ketoacidosis, DKA. C. Hyperosmolar hyperglycemic state, HHS. D. Stroke. Answer: B. Diabetic ketoacidosis, DKA. This question tests your ability to differentiate between diabetic emergencies based on presented signs and symptoms. The keywords diabetic, unresponsive, warm and dry skin, and especially rapid, deep respirations, Kussmaul breathing, are classic indicators of diabetic ketoacidosis, DKA. DKA occurs when the body produces high levels of ketones due to insufficient insulin, leading to acidosis and the characteristic Kussmaul breathing as the body attempts to blow off excess acid. For instance, imagine the body trying to exhale the acid through rapid, deep breaths, which is a hallmark of DKA. Always remember Kussmaul respirations in a diabetic patient suggest DKA. Question 11. An adult patient refuses transport to the hospital after you have explained the potential risks of refusing care. The patient appears competent and oriented. What is your most appropriate action? A. Administer treatment against their will. B. Contact medical control for guidance. C. Have them sign a refusal of care form and explain the risks again. D. Call law enforcement for assistance. Answer: C. Have them sign a refusal of care form and explain the risks again. This question addresses the critical ethical and legal principle of patient autonomy and refusal of care. If a competent and oriented patient understands the risks and still refuses transport, you must respect their decision. The most appropriate action is to ensure they are fully informed of the risks, document this explanation thoroughly, and have them sign a refusal of care form to protect both the patient and the EMS provider. For example, if an alert patient doesn't want to go to the hospital, you must respect their decision, but you also need to make sure they know what might happen if they stay home and you have a record of that conversation. Always document extensively when a patient refuses care to protect everyone involved. Question 12. A 32-year-old male has fallen approximately 20 feet from a ladder. He is conscious but confused and complains of severe back pain. What is your immediate priority regarding his spinal motion restriction? A. Apply a cervical collar before moving him. B. Log roll him onto a long backboard. C. Maintain manual inline spinal motion restriction. D. Assess motor and sensory function in all four extremities. Answer: C. Maintain manual inline spinal motion restriction. This question tests your knowledge of immediate spinal motion restriction principles in a potential spinal injury. The keywords fallen approximately 20 feet and severe back pain indicate a high mechanism of injury and potential spinal trauma. The immediate priority is to establish and maintain manual inline spinal motion restriction to prevent further injury during the initial assessment and until a cervical collar and/or other spinal immobilization devices can be applied. For example, if someone falls from a height and might have a back injury, the very first thing you do is gently hold their head still and in line with their body to prevent any further movement that could cause more harm. Always ensure manual stabilization of the head and neck as the first step in suspected spinal injury. Question 13. A 72-year-old female presents with sudden onset of slurred speech, facial droop on the right side, and weakness in her right arm. She last appeared normal 2 hours ago. What is the most critical piece of information to obtain for hospital notification? A. Her medical history. B. Her current medications. C. The exact time of symptom onset, last known normal. D. Her allergies. Answer: C. The exact time of symptom onset, last known normal. This question highlights the critical importance of the last known normal time in the management of stroke patients. The keywords sudden onset of slurred speech, facial droop, weakness point to a possible stroke. The most critical information is the last known normal time because it determines the patient's eligibility for time-sensitive, potentially life-saving treatments like thrombolytic therapy at the hospital. For example, if a stroke patient arrived at the hospital within a specific time window from symptom onset, they might be eligible for medications that can dissolve the clot and minimize brain damage. Always prioritize obtaining the last known normal time for stroke patients to facilitate rapid hospital treatment decisions. Question 14. What are the 4 vital signs commonly assessed by EMTs? A. Blood pressure, pulse, respiration rate, and body weight. B. Heart rate, respiratory rate, blood pressure, and temperature. C. Oxygen saturation, pain level, pupil response, and blood glucose. D. Level of consciousness, skin condition, capillary refill, and pulse. Answer: B. Heart rate, respiratory rate, blood pressure, and temperature. This question assesses your basic understanding of the fundamental vital signs routinely assessed in pre-hospital care. While all the listed options are important assessment components, the universally recognized 4 vital signs include heart rate, or pulse, respiratory rate, blood pressure, and temperature. These 4 measurements provide a quick and essential snapshot of a patient's physiological status and can indicate underlying medical issues. For example, just like a car's dashboard lights tell you about its engine, these 4 vital signs tell you a lot about a patient's overall condition. Always remember these core 4 measurements as the foundation of your patient assessment. Question 15. Why is detailed and accurate documentation of patient care so important for EMS providers? A. It is required for billing and reimbursement purposes only. B. It provides a legal record of the patient's condition and care provided. C. It helps you remember the call later for storytelling. D. It determines if you are eligible for overtime pay. Answer: B. It provides a legal record of the patient's condition and care provided. This question emphasizes the crucial role of thorough documentation in EMS. The core reason for detailed and accurate documentation is that it serves as a legal record of the patient's assessment, interventions, and condition at the time of transport. This record is vital for continuity of care at the hospital, legal protection for providers, quality improvement, and research. For example, if there's ever a question about the care you provided, your patient care report, PCR, is the definitive proof of what you did and why. Always remember that if it wasn't documented, it wasn't done, and good documentation protects both the patient and you. Question 16. A 28-year-old male was stung by a bee and is now complaining of generalized itching, hives, and difficulty breathing with inspiratory stridor. His blood pressure is 80/50 mmHg. What is the most appropriate initial medication to administer? A. Diphenhydramine, Benadryl. B. Epinephrine. C. Albuterol. D. Oxygen. Answer: B. Epinephrine. This question describes a classic presentation of anaphylaxis, a severe allergic reaction. The keywords be sting, generalized itching, hives, difficulty breathing with inspiratory stridor, and critically, blood pressure 80/50 mmHg, hypotension, are all signs of a life-threatening allergic reaction. Epinephrine is the most appropriate initial medication because it rapidly reverses the effects of anaphylaxis by causing vasoconstriction, raising blood pressure, and bronchodilation, opening airways. For example, if someone's throat is swelling shut and their blood pressure is dropping after an allergic reaction, epinephrine is the immediate life-saving drug that buys them time. Always remember that epinephrine is the first-line treatment for anaphylaxis. Question 17. You are caring for an unresponsive patient with pinpoint pupils and slow, shallow respirations. Paramedics are en route. What is the most appropriate medication to consider administering if available and protocols allow? A. Aspirin. B. Naloxone. C. Activated charcoal. D. Oral glucose. Answer: B. Naloxone. This question tests your ability to recognize signs of an opioid overdose and the appropriate treatment. The keywords unresponsive, pinpoint pupils, and slow, shallow respirations are classic indicators of opioid toxicity. Naloxone is a specific opioid antagonist that rapidly reverses these effects by blocking opioid receptors in the brain. For instance, if someone has overdosed on opioids and is barely breathing, administering naloxone can quickly restore their breathing and consciousness. Always consider naloxone for patients presenting with signs and symptoms consistent with an opioid overdose, especially respiratory depression. Question 18. When assessing an elderly patient who has fallen, which of the following is most important to consider in addition to the visible injuries? A. The patient's usual activity level. B. The potential for underlying medical conditions causing the fall. C. The presence of family members at the scene. D. The type of flooring they fell on. Answer: B. The potential for underlying medical conditions causing the fall. This question emphasizes a critical aspect of geriatric patient assessment following a fall. While visible injuries are important, the most important consideration is to determine if an underlying medical condition, such as a cardiac event, stroke, syncope, or medication side effect caused the fall itself, rather than the fall simply being an accident. Identifying the cause of the fall can be crucial for preventing future incidents and guiding appropriate medical treatment. For example, an elderly person who fell might have actually had a small stroke that caused them to lose balance, rather than just tripping. Always investigate the reason for the fall in elderly patients, as it often points to a serious underlying medical issue. Question 19. What is the maximum flow rate for a nasal cannula? A. 2 lpm. B. 6 lpm, C. 10 lpm, D. 15 lpm. Answer, B. 6 lpm. This question tests your practical knowledge of oxygen delivery devices. A nasal cannula is designed for low-flow oxygen delivery and is typically used for patients who require minimal supplemental oxygen or are uncomfortable with a face mask. While it can technically go higher, the maximum effective and commonly recommended flow rate for a nasal cannula is 6 lpm, as higher flows tend to dry out the nasal passages and become less efficient due to air mixing. For example, if a patient needs more than 6 lpm, you should consider switching to a different oxygen delivery device, like a simple face mask or a non-rebreather. Remember that a nasal cannula is best for mild hypoxia and patient comfort, up to 6 lpm. Question 20. A 19-year-old female experiences a sudden, generalized tonic-clonic seizure. The seizure lasts approximately 2 minutes, and she is now postictal. What is your immediate priority during the postictal phase? A. Administer oral glucose. B. Restrain the patient to prevent injury. C. Protect the patient's airway and monitor breathing. D. Request an advanced life support (ALS) unit for anticonvulsants. Answer, C. Protect the patient's airway and monitor breathing. This question focuses on the immediate post-seizure care. After a tonic-clonic seizure, patients enter a postictal phase, characterized by confusion, drowsiness, and altered mental status. During this period, the immediate priority is to protect the patient's airway, often by placing them in a recovery position to prevent aspiration, and monitor breathing, as respiratory depression can occur. For example, after someone has a seizure and is coming out of it, their airway might be compromised due to their altered mental state or secretions, so ensuring they can breathe freely is paramount. Always prioritize airway and breathing during the postictal period of a seizure. Question 21. A patient has full thickness, 3rd degree, burns covering their entire left arm and chest. What is the most appropriate initial treatment for the burn injury itself? A. Apply ice packs directly to the burned areas. B. Cover the burns with dry, sterile dressings. C. Break any blisters that are present. D. Apply a burn cream or ointment. Answer, B. Cover the burns with dry, sterile dressings. This question tests your knowledge of initial burn management. For full-thickness burns, the primary immediate treatment is to cover the burns with dry, sterile dressings, or a clean sheet if extensive. This helps to prevent infection, reduce pain by protecting nerve endings, and prevent hypothermia, as large burns can lead to significant heat loss. Applying ice can cause hypothermia and vasoconstriction, further damaging tissues. For example, after the fire is out, the next step is to protect the injured skin from the environment and infection. Always cover significant burns with dry, sterile dressings to protect the patient. Question 22. During your secondary assessment of a trauma patient, what is the purpose of reassessing vital signs? A. To determine if the patient is malingering. B. To gather enough data for insurance billing. C. To identify trends and changes in the patient's condition. D. To confirm the initial vital sign readings. Answer, C. To identify trends and changes in the patient's condition. This question highlights the purpose of ongoing vital sign assessment in patient care. Reassessing vital signs during the secondary assessment and throughout transport is crucial not just to confirm initial readings, but primarily to identify trends and changes in the patient's physiological status. These trends, example a dropping blood pressure, rising heart rate, can indicate improvement, deterioration, or the effectiveness of interventions. For example, if a patient's heart rate keeps climbing and their blood pressure keeps dropping over time, it tells you they are getting worse and potentially going into shock. Always look for trends in vital signs to understand how your patient is responding. Question 23. What is the primary reason for effective and clear communication with medical control? A. To receive authorization for advanced procedures. B. To confirm your arrival at the scene. C. To provide a brief patient handoff report. D. To obtain orders and guidance for patient care. Answer: D. To obtain orders and guidance for patient care. This question focuses on the essential role of medical control in EMS. The primary reason for communicating with medical control is to obtain orders and guidance for patient care, especially for interventions that require physician authorization or for complex patient presentations where advice is needed. This ensures that the patient receives the most appropriate and protocol-driven care under direct medical supervision. For example, if you need to administer certain medications or perform specific procedures outside of standing orders, you must call medical control to get the green light. Always communicate clearly with medical control to ensure patient safety and adherence to protocols. Question 24. A patient is found unconscious and severely hypothermic after being exposed to cold weather for an extended period. What is the most appropriate initial action regarding moving the patient? A. Rub their extremities vigorously to warm them. B. Rapidly rewarm them in a hot shower. C. Handle them gently and avoid rough movement. D. Encourage them to walk around to generate heat. Answer: C. Handle them gently and avoid rough movement. This question addresses the critical principle of managing severe hypothermia. The most appropriate initial action for an unconscious and severely hypothermic patient is to handle them gently and avoid rough movement. Rough handling can trigger ventricular fibrillation, a dangerous irregular heartbeat, in a severely hypothermic heart, leading to cardiac arrest. For example, imagine a frozen heart being extremely fragile. Any sudden jolt could cause it to stop. Always move hypothermic patients with extreme care to prevent life-threatening arrhythmias. Question 25. You are the first arriving unit at a mass casualty incident, MCI. Your first action, after ensuring scene safety, should be to A. Begin immediate triage of all patients. B. Establish command and provide a scene size-up report. C. Transport the most critical patient immediately. D. Request additional resources from dispatch. Answer: B. Establish command and provide a scene size-up report. This question tests your understanding of initial actions at a mass casualty incident. After ensuring scene safety, the first action for the first arriving unit at an MCI is to establish command and provide a comprehensive scene size-up report to dispatch and incoming units. This sets the stage for organized and effective incident management, ensuring resources are appropriately requested and deployed. For example, arriving at a large accident, the very first thing you do is declare yourself in charge of the scene, assess the overall situation, and tell everyone what you see so help can be sent where it's needed. Always establish command and report your findings immediately to begin effective MCI management.